Hey, chronic low back pain sufferers. If you've had low back pain for over 18 months and have had horrible constant pain over 8 out of 10, like our patient Jess here, watch this video because we have an answer for you.
Last time you were here, you were feeling 80% overall improvement. Are you feeling better, the same, or worse since last time you've been in?
Way better.
Way better?
Yeah,
awesome.
way better.
How much percent better? You're at
I'd say like 90% better, honestly,
Awesome.
since we started.
Awesome. What did you notice feeling better since last treatment?
I feel the pain when I'm standing and sitting and laying down anymore.
Jess is a 43-year-old graphic designer who has had 1.5 years of constant pain. I'm just gonna show you. She had constant pain from her low backs all the way down to her feet, 8 out of 10, all the time. A lot of times people have chronic pain and it could just be a mild thing or it comes and goes. Jess had 18 months straight of horrible low back pain.
See right there.
Yeah. 72. What do you feel right here?
Just a stretch.
Back here?
Yeah, and then like down there.
Down here?
Yeah, in the front.
Up here?
Mm-hmm.
0 to 10 up here?
5.
5. 80 over here. 0 to 10.
The stretch?
Mm-hmm.
Probably like a 6. 5
And
or
where
6.
do you feel it?
Back.
All this.
Mm-hmm.
James is starting with her straight leg raise or her hamstring stretch tests because last visit she was 80% better. This visit she's 90% better. Last visit she was 80% better. Her straight leg raise on the right was 61 degrees and on the left it was 58 degrees. So while her symptoms were very much improved, any time range of motion isn't maxed out to as close to 100% as possible, which for this test is 90 degrees, we just know that they're going to develop adhesion much more quickly than they would if their range of motion were full.
Great. That is at 11 3/4. What did you feel there?
Just like I don't stretch often enough.
Where was the stretch?
Right in here. Sitting a little bit, but yeah, I don't feel it standing or when I lay down anymore. There's a bit of a sharp pain if I bend over too quickly.
When you do it quickly, how sharp is that pinch? That
It's just-
happens
it's
like
like it's-
8 out of 10?
It's probably like a 7.
A 7.
Yeah.
And it's still on that right side, it hasn't moved, right?
Correct.
Got it. This morning when you woke up, 0 to 10.
Again, I'm good until about 30 minutes in, and then it's like probably like a 1 or a 2.
Notice how specific Jess is answering James's questions. Jess has been trained how to answer these questions. In the beginning, when we start seeing chronic pain patients, they are often not specific at all. They're very vague because they're not always paying attention to what's going on and they don't necessarily think that all of the specific information matters. So if Jess is doing some type of activity for 3 minutes and her symptoms are 2 out of 10, that is a measuring stick. Compared to what it was before, maybe it was 10 or 15 minutes, it was 5 out of 10, maybe before that it was 30 minutes, it was 6 out of 10. All of the details, the variables, as far as when somebody experiences pain matter. And so if you're seeing doctors and therapists who aren't using specific measuring sticks, and then you're coming into this office and you're like, I really don't like all your questions, and then we tell you, well, these are the questions that we need to ask you in order to actually fix you, there's a method behind our madness.
I like it. You doing your exercises
I am.
every day?
This past, like, okay, the holiday season is a little difficult,
Okay.
a little stressful, but
That'll be the most important thing for you to do to make sure that you stay well.
So this is a thing that happens several times a day. Are you doing your exercises? And what I said before, ranges of motion need to be at 100%. Once a range of motion is at 100%, they have minimal adhesion in all the structures that would limit that range of motion or that test. Then it's time to strengthen every single day. So we typically give people 4 to 5 exercises over the course of a low back protocol that are super, super important, very bang for your buck and foundational, and they're expected to do them every single day. Sometimes we give people exercises and people think to themselves, this is just a luxury thing. And then I have to explain to them, doing these exercises is a part of your treatment plan. So strengthening is vitally important for somebody's long-term health. It's how you minimize adhesion buildup. If strengthening isn't working when you have chronic pain, that just means that you have a lot of adhesion that has to be removed first. So step 1, if you remember algebra, order of operations, you multiply before you add. You remove the adhesion first, then you strengthen, and that's what allows people to be successful, make pain go away, and stay away.
Good. And your symptoms are the worst right back here.
mm-hmm.
Pretty much only here.
Yeah, that's it.
Okay.
So if her symptoms are right back here, often you want to check the symptoms right in the back side, but also immediately on the front side, because they both control this level that she's feeling symptoms at L5S1. So I'm just going to come in here and feel for hardness or crappy tissue and let that be my guide. The lateral femoral cutaneous nerve comes this way before it goes underneath the inguinal ligament right here, and it does not feel great. Drop the knee down a little if you can. Good. So this is the posterior portion of the iliacus. I'm on the pelvis still, and it's just really gunky. Just put my finger in there, and I just felt my muscle my finger get sucked in.
Your mama.
Your mom's finger got sucked in. She's feeling better, so she can joke around. This is great.
Much better than I was able to do before.
The other day, James had this video and he's like, should I take that joke out? And I thought about it. I said, no. She's feeling, when she first came in here, she was not smiling and happy and laughing like this. And over the visits, she's been laughing more and joking more. And this is what is supposed to happen as somebody is getting good treatment. They're supposed to have less pain so that they can actually be more present to their life. And she's a fun-loving person, and she's making a your mama joke at me, so I made a your mama joke back at her. That's what we do at Barefoot Rehab. And then the anterior hypogastric comes in here, and it doesn't want me to bow the nerve that way. Okay, go. I don't like it. Coming back.
What didn't you like?
The tension didn't ramp up, mainly because I rushed the setup. So I'm gonna be slower right now. Go. That's better. Just building a lot faster. Because to have a good tension or a good treatment pass, there should be a lot of tension. If there's not a lot of tension, then I wouldn't expect her to have sustained relief. So it's not just about putting our fingers somewhere and hoping that's going to get better. I need to create tension on the adhesion in order to trust that I'm tearing it. So right at L5S1 disc, her multifidus, right on the midline here, there's just a little, someone took Elmer's glue and just went and put it right there. So we're going to remove this little strip. And my hope is after today, she's 100% better. About 6 months ago, I was getting treated by my mentor, Dr. Matt at Precision Health Group, and he was treating erector spinae adhesion connected to the supraspinous interspinous ligament. I didn't realize it could be so close to the crevice of the midline. So that's what I found on Jess and what I'm treating right now. Okay, good. Crunch your belly, Jess. Good. James is helping her crunch up. She has some strength, but the more range of motion we'll get, the more we'll tear the adhesion. So we've been using the assistant to help us flex her spine more to just get better treatment passes so we do less. And then it's a better dosage of medicine each time we do treatment. Good. Crunch, 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 crunch. Oh, crunch. Good. The rule with radial shockwave, if you're treating muscle adhesion, is that the tissue needs to have high relative tension on the tissue. We typically would start this in the cat-cow position. The next position would be seated and they're flexed forward. The next position is them touching their toes. This puts even more tension on it than those previous two positions. The risk with this is that if somebody has a disc issue and they're hanging out there too long, they'll get up and they'll be inflamed or sore for 24, 48 hours. But I trusted that I could get this treatment. I could treat her this way with her touching her toes. And when she came to the next visit, she didn't have any flare-up. So that just told me that she could handle this and I made the right decision. If you want to see the full version of this video, click here.